Hello everyone, I am Dr. Mahati Priyadarsini, Medical Director and Chief Consultant Critical Care Medicine and Pain Medicine at Gaman Multi-Specialty Hospitals. Today I am going to talk about the most hot topic at this point of time, Omicron. So what is Omicron? What is different about this strain of the COVID virus? What should we be knowing about this and how we can prevent ourselves from this virus? So the Omicron virus it has been classified as variant of concern by WHO, and it has been categorized as B11529 variant and has been named as Omicron. It was first reported in South Africa. There was a sudden increase in number of cases in Gauteng province in South Africa, where this highly mutated variant was identified and reported. What is different about this strain? Due to this high mutations, there is a high chances of this variant escaping the general immunity developed in the population, either due to the antibodies developed due to previous infections or vaccination. It is of greater concern because of its high transmissibility and unusual collection of mutations, and hence it is different from the other variants of concern which have been identified till now, like alpha, beta and the delta variant. This variant has a large number of mutations, and because of this it has been identified as a variant of concern. WHO usually classifies the viral variants as variant of interest or variant of concern. They call it a specific variant as variant of concern when either it has high transmissibility, that is it can spread very easily, or it is very virulent, that it can cause more morbidity and mortality, like the patient has to get admitted in the hospital, decrease in oxygen saturation levels, or causes more deaths, or it escapes the general public health measures that have been taken, like vaccinations or therapeutics. So these are the criteria for WHO to categorize as variant of concern. The data presented by South Africa's health department says that due to its mutations, it has increased chance of escaping the previous antibodies developed, either due to vaccines or infections. And so the WHO about this virus. Omicron virus has almost 50 mutations, and out of these 50, 30 are in the spike protein. Spike protein is the region which first comes into contact with the human cell before the virus entering into the cell. The receptor binding domain, the area which is area of the virus which is coming in contact with the human cell, has almost 10 mutations as compared to 2 mutations in the Delta virus variant, and still the Delta virus had high transmissibility, and it was the dominant variant which dominated the whole world. So these kind of mutations are usually assumed to have come from one person who could not clear the virus from the body, and hence gave the virus the chance to evolve genetically. The same theory was proposed for the alpha variant also. The Omicron variant has already been identified in Botswana, Hong Kong, Japan, Australia and UK, and many other countries are also conducting genetic sequencing to identify the variant. Many of the mutations in the Omicron variant have been related to increased antibody resistance. So what does it mean to us? Increased antibody resistance means there might be increased resistance to vaccine, or we don't know the pattern of inoculation. That means once we get infected with the virus, how the response is going to be, how the transmissibility is going to be, and how the response to therapeutics, that is the medications that are being used to treat COVID, is going to be. So how to tackle this situation? We have two options. Either we wait for some more time to get more evidence, or we act aggressively now and back off later if it wasn't required. And personally I feel that probably it is better to be more aggressive and then back off if it is not required. So now coming to the most important part, what are the symptoms of Omicron variant? Are they different from the other variants? So the people who have been infected with this variant have complained of extreme tiredness, and this extreme tiredness is not limited to any age group. Even the very young people have been complaining of extreme tiredness. The second common symptom is there is no significant drop in oxygen saturation level as it was seen with the Delta variant, because of which many people required hospitalization. The third symptom is there is no loss of smell or taste, which was usually being seen with the other variants, and many people with this infection did not require hospitalization, is what has been told by the doctors in South Africa, where the maximum number of cases have been seen until now. So the next big question, can the routine RT-PCR test identify the Omicron variant? Yes, the Omicron variant can be identified by the regular RT-PCR test, but we cannot differentiate that with whether it is a Delta variant or a Omicron variant. For this, gene sequencing needs to be done, which takes 26 to 96 hours to get a result. But in RT-PCR, they use a technique called identifiers. So usually 2 identifiers are used in the RT-PCR testing. So when there is a mutation in the spike protein, which is the part which is coming into contact with the cell to infect the human body, if that is missing, the other identifier will be detected. So in Delta variant, spike protein identifier is detected. Even if the spike protein identifier is absent, it shows that the person has COVID infection, and due to the positivity of the second identifier, it can be assumed that the infection could be with Omicron variant. Actually, this can be seen even with the Alpha variant, but because the Alpha variant is negligible, it is barely seen, rarely seen nowadays, it can be assumed that it is Omicron variant. So if the identifier is missing on the spike protein and is visible on any other part of the virus particle, then further gene sequencing can be done to identify the Omicron variant. Regularly sanitize your hands and please maintain social distancing, and please get vaccinated if you have not got vaccinated until now, because definitely the vaccine will bring down the severity of the disease. It might not protect us from getting infected, but it will save us from getting admitted in the hospital and dying because with the COVID infection. So please follow the 3 important things: wearing a face mask, hand sanitization and social distancing. And we'll keep you posted on further upcoming information on this variant, and I'll keep in touch with you. Thank you.